Well, I am Pedro Rivera, plastic surgeon from Buenos Aires, Argentina. I will talk about some trick and clues, some solution for this lipoatrophy of the middle part of the face by implant, fat grafting, and fillers. This is part of my brief CV. I don't have any conflict of interest for this conference. First of all, as you know, we have different kinds between the shape of the face, the ideal shape of the face, and between female and male is about the malar projection because the ideal shape of the face on the female is a triangular way. Malar for male is more rectangular or square face. And here is the same drawing in which one we put female characterization and the other one we put male characteristics. And here is the proof on the malar and zygoma area is more projection on the female and more wide on the male. To obtain that, a trapezoidal shape on the face, on the beautiful face on the female, are a beautiful face of male is more characteristic rectangular face. I introduced this colleague of mine, is a plastic surgeon from Peru, Oscar Ramirez. He is nowadays living in the USA. He created this phrase of a line of beauty by this double sigma arc or double S arc. As you can see here, after that, he write many articles mention that. What is that? When you put the patient in oblique profile or three-quarter view, you can see very well this double S with a combination of sequence of convexity, concavity, great convexity, and slow or light concavity. That's the way of the ideal projection of the malaria, especially on female. And you know, the female usually use makeup to create this double S because they put bronzer in some part and highlight to create this line of beauty, this double S, make it by makeup. Because our surgical objective is that change one faces or square faces to an ideal triangle or trapezoid faces. This is our idea, this is our goal, and we look for that with these kind of solutions. These are all the causes that can obtain a deterioration or deflation of the middle part of the face. We have some genetic, this Binder syndrome, aesthetic reason that's in this case, extreme weight loss, 30 kilos in this case, aging process, something which is happening with all of us right now, antiretroviral medication, adverse effects, like in this case. I'm going to show you in which way I handle with all these all problems. Oh, you know, it's only to remind you that the facial fat pad, when the time goes by, start to fall down and to decrease the volume in this way. And that's why we need to put in balance this possible solution to this problem. We can lift, or we can increase, or we can do the both procedures at the same time. If we choose lift, it's only by a surgical way. We can obtain by superior endoscopic fat pad suspension, as Oscar Ramirez made and describe it, or orbital ring fat pad suspension, like Hester or Osan. They put the stitches in the bone in the orbital ring, filling up all the malar fat pad with only one stitches. Or we can choose increase the volume by synthetic filler, fat grafting, or implants. That's why this is the hot topic of today, the synthetic filler, fat grafting, or implants. First, a little secret. This is a great clue for all of you. If you have a logical doubt about how many volume you need to put on the middle third part of the face, or which kind of treatment you need to choose, during the appointment we can discuss with the patient, and you can offer that. A water test. I use saline solutions with this cannula in the malar area, and I put the quantity of solution that my patient decide is good enough to obtain a better projection in this part of the face. By this, the solution is going to still for 2 to 4 hours, in some cases 4 hours, good time enough to decide if this projection is good enough for her and for me. And here is the proof in video on Vectra system. I performed the Malaf water test on the left side of the face, as you can see here, but not in the right side, because I can compare, as you can see here, the size, the quantity of this double S line. Here is a grade obtained the grain curve of this double S, and this is a flatnet. That's why we prefer and we choose that 7cc to have this kind of solution. Again, you need to put the balance: temporary as fillers with permanent as implant, procedure at the office, fillers, operation with fat grafting or implant, prosthesis have a cost against lipofilling of fat is for free, and HA have a cost important when you add many quantities of CC. That is the you need to balance cost benefit, pros and cons. Non-surgical surgical options. We start with non-surgical options. Fillers, HA, and in my case, polyacrylamide was legal in Argentina. I performed this kind of fillers until 2016, 2017. Nowadays, I don't do it anymore for the risk, because if I put it inside artery, is a disaster by this. Well, when I choose this kind of surgical option, fat grafting or implants, I have 3 options: precast silicone implant, polyethylene implant, and polytetrafluoroethylene implant. I talk a little about all of this. Cases and results. First, with HA and polyacrylamide. This is the patient for aesthetic reason, in which one we obtain and change this flat face with this round-shaped face and this nice curve in the middle part of the face made by fillers. In this case, was 3 to 4 cc's. This great quantity of syringe and quantity of HA, in this case close to 10, to obtain this great projection in the malar area and the zygomatic area, because it's male patients. This typical HA retroviral medication lipoatrophy, I need at least 12 cc, and not only in the malar area and the cheek, as you can see here, with great depression. And the way we can improve, and as you know, as was polyacrylamide permanent permanent filler, this is a permanent solution. When we choose and we talk about surgical solution, I want to talk about these topics. When I mentioned the lipofilling, I perform micro fat grafting. I never use nanofat because it's only as a stem cell improvement or biostimulation, but it's going to disappear in a few months. Sorry for the chin area, because I don't record when I put it in the malar area. For example, for this aging process reason, a total of 20 cc of micrograft in the malar area to obtain this great change in the shape in this third part of the middle third part of the face. More quantity, 40 cc in this HIV medication lipoatrophy, as you can see here, not only malaria on the cheeks too. Another high profile view and a complete profile view to measure well here the result after a complete year, and we still have with beauty change in the face of this male. The depression and in which we increase the volume. And in this video by Vectra system, you can measure well our result, the measure of my result. And if I was at least for a complete year, for sure, more quantity of this fat cell is going to still forever. majority of the fat cells. And here is a combination of depression by bichectomy and increased the volume malaria with this malar fat graft. Beautiful double S line. And the proof of that, when in vector system, where the color blue and light blue is increased volume here in both malaria, and the price is equal as yellow or orange. As you can see here, why with that we going to simulate the same of you obtain by the makeup, but a permanent makeup and permanent this double sigma S line of beauty. In this male, we this combine of chin implant and malar fat graft to obtain this beautiful result. In more complex pathology like this malformation reason, facial asymmetry, macrogenia, in this one, we have different gonial angles, deficit of fatty tissue over the left cheek, and bilateral malar poor projection. Well, this is our surgical plan: chin ostectomy, asymmetrical chin ostectomy, left gonial polyethylene implant, left cheek fat grafting, and bilateral malar fat graft. Give me the possibility to obtain this beautiful result. And the important part for you to measure well is the increase of this double S in the middle third of the face. The other profile, the same good result. When measured and we want to increase this volume forever, we choose implants, as you can see here. First, if I choose silicone implant, is by his easy way to attach and to use, and is the cheaper one. And here is the way I, in an in vitro proof, I pass these stitches over the periosteum first, then attached with the implant. With only one stitch, I obtain this fixation under the periosteum, and for sure this implant can move in any moment on the life of the patient. Always keep in mind infraorbital nerve if you choose any kind of implant introduction, because if you put over the erase the immerse of the nerve, you can obtain obtain a paresthesia in some cases forever. That's why you need to keep in mind when you try to customer your own implant, as you can see here. Well, in some cases, I only use malar silicone implant. Yeah, and this is interesting in this case because he started and decided this first projection. He refused of the result and request a new procedure, as you can see here, with better projection in this complete profile. This is our projection with this size, and the bigger size, we obtain this great curve. More complexity in the aesthetical reason is this patient with lower self-esteem was sent to me by his psychiatric because he won't look for extreme change on the nose, gonial area, chin, and malar area. And this is my surgical plan: rhinoplasty, chin precast silicone implant, gonial polyethylene implant, and malar precast silicone implant to obtain this complete change. Oh, sorry for that. First, I show you the proof in the way in the surgical room in way I attach the implant, as you can see here, with only one stitches here on the periosteum, and of course this is the pocket in the sub periosteum and attached to the bone in some cases forever. And this is a great change. A change I obtained over the patient, as you can see, the great projection in the middle third part of the face by this kind of implant. Flat face and round shape or trapezoidal shape. And another proof about that of my words that this change is still forever, as you can see here, before and after, and 10 years of follow-up. I need to say that I'm not the responsible of these lips. I hate this kind of lips. But here's the proof that after 10 years, he still have the same projection on the malar area due by the implant. When you mention polyethylene implant, I want to talk only about the malar area. And first, sorry for this video on the chin area. First, you need to have some skill in maxillofacial surgery, because you need to use a drill for drilling. And after that, you need to have the skill to put the screw, because this kind of implant need a rigid fixation. But it's the better implant because it's got a great quantity of holes and porous, and our tissue growing inside of it. That's why we have a complete attachment. And if I want to take out, in 2 or 3 years, I need to broken, in some cases, broken the bone, because it's inside of it. And here is before, when you use the pocket, you put the implant, and the proof of the rigid sorry, in the chin area. Because in some cases, like in this patient lose 30 kilos. That's why I have complete lipoatrophy in the middle part of the face, and the way I can change the shape of the face by this implant. Again, in a complete from view. When you talk about polytetrafluoroethylene implant, it's interesting because have this porous too, and is not rigid fixation. It's not the rigid, not need a rigid fixation. It's only, again, with the stitches, and again I can customer as I want, only by the scissor. And here is the proof during my procedure in the surgical room. First, I measure the malar on the face of the patient. I decide it's too big. I start to cutting with the scissor. I perform the pocket, and after that, I put the implant. Left side with the implant inside, right side waiting for the implant. And to obtain this great change in the flat face to a round-shaped malar area face. In another way to reduce the weight and reduce the malar fat part is by extreme exercise, like this guy. At the same time, I proceed. I made blepharoplasty to take out the orbital fat part and increase the volume in the middle third part with this polytetrafluoroethylene implant. Close just to the end. Listen to my take-home message, and I am on time. First, taking account the double sigma line, the line of beauty, double S line, for me is a great clue when you want to get improved in this part of the face. If you have any doubt, you or your patient during the appointment, please perform the water test. It's cheaper, faster, easy to perform, and for sure it gives you the correct quantity of volume you need to add to the face. If the water test is greater than cc, on my case, and in a way to think, I evaluate to use to the surgical room. When the volume decrease is over the malar and cheek area, I choose fatgraft because with implants is not good enough. When you or your patient want a significant or permanent result, for sure the choose one is the implant. If I choose implant and the price is the problem, I need to choose silicone implant. If not, and I want to make it in an easy way, only by the stitches, I choose polytetrafluoroethylene implant. But my best choice is if I have the patient have the money to pay for this surgical rigid fixation and for buy this polyethylene implant. This is my best choice. Invite all of you for the next meeting or Congress of IMCAS, the first one in January in Paris. I am part of the board of IMCAS America. That's I wait for all of you in the beautiful city of Sao Paulo. Finally, thank you. May the force be with you.